Today, then, we're just going to be talking about just recapping on what the menopause is. So, menopause is the ending of fertility and our menstrual cycles. So, this can happen really from sort of like anywhere between our late 40s to our early 50s. And it's all related to the change in hormonal levels. So, the estrogen, progesterone, and testosterone that our ovaries are producing levels dwindle down during the early stages of our menopause journey, which is generally the perimenopausal stage. And then we produce no hormones from our ovaries when we're postmenopausal. So it's fluctuations and sort of like reduced levels of these hormones until there's nothing there. So the menopause is really being caused by a deficiency in hormones. So our ovaries that were producing all these lovely hormones for all of our adult life suddenly aren't producing the hormones to a certain level that are making us symptom free. So as levels drop, suddenly we then get the symptoms of the deficiency symptoms, such as hot flushes, anxiety, brain fog, all the things that we've talked about. The physical effects are the vasomotor symptoms, such as the hot flushes and the night sweats. The psychological effects, which impact women more than the physical symptoms. And so it's really, we've discussed this in quite a few details. So when do the symptoms start? Well, they can start really at the sort of like from your 40s onwards. And when do they end? Well, for some women, they don't end. They continue for the whole of their lives. And I think it's just being aware that we're all different. And that might not, we might be ones that don't have too many symptoms, or we might get horrendous ones. We just don't know. And hormone replacement therapy is about replacing the exact hormones that your ovaries are no longer producing in order so that you don't get any of the symptoms and you feel better generally, and it improves your long-term health. Thank you. So today, these sessions really are going to be talking about getting advice and support, what to do, how to get it, and what's available to us really. So, I mean, the first thing that we need to think about is that the most important person that we should really be talking our symptoms through is the GP. So, I do hear mixed responses from people all the time about this. And, some people have really good reports with their GP. Some people have had great experiences. They've seen their GP to discuss menopause and they've had a wonderful time, great experience, feel very positive about it. But other people don't. And, a lot of it can be just the factor that you actually, because of your menopausal symptoms, you're not coping with maybe confrontation or discussion correctly. You've misheard, or you've felt that you weren't listened to properly. And so there are lots of factors that can come into this. So it might not just be the fact that the doctor hasn't supported you as much. It might be things to do with the past. It might be the way that you're feeling on that particular occasion is the reason why you felt that the doctor hasn't supported you that day. If your confidence is low, your brain isn't working correctly because you've got brain fog, you're not taking it all in, you might have misheard or misunderstood, or just got a vibe that something wasn't right and felt unhappy about that. But really, the GP is the first person you should be talking about your menopausal symptoms for. And of course, at the moment, we've got all this dilemma of, trying to get an appointment can be horrendous. You can wait weeks and weeks for a telephone appointment. But to actually see somebody face to face can be even longer. Or obviously, we're still doing like Zoom calls at the moment. And it's working out what's going to suit you. For some women, having a face-to-face appointment with a GP is what's absolutely necessary. For other people, they might feel quite comfortable to talk about their symptoms over the phone and the doctor to listen and go, yeah, that's fine. I think it's this and this is what we're going to do. It's very much based on what you need and how you feel and what you actually need from the doctor at that particular time. So, trying to get a face-to-face appointment will take longer than a telephone appointment. But the main issues, again, it doesn't matter whether it's a telephone consultation, Zoom or face-to-face, is the lack of time that you're actually with your GP. As we know, GPs on average spend approximately 7 minutes on each appointment. And menopause is so complex. You can't actually get the words out and explain yourself in the best possible way in such a short amount of time. And so this is really where the problems start, and that you don't feel listened to. You don't have time to explain how you're truly feeling, or the main things that are bothering you about the menopause. Maybe because of the menopausal symptoms that you're not able to explain yourself correctly, or come across in the way that you want to come across. Or it's just the fact you've just run out of time. You've been discussing the fact that you haven't slept for years and you feel dreadful, etc. And suddenly the time's out, and the doctor's thinking, well, actually, you've just talked about not being able to sleep, so let's just deal with that element of your symptoms. That's why you've come today. And again, it's because of the lack of time. You haven't got that time to explain things in greater detail. So time is a factor. But we need to speak to our doctors to find out who within the practice does understand menopause. Is there anybody that has any special skills focused on women's health and menopause within the practice? And I think if you've had some, some not great experiences in the past with your GP, or you found a GP has been incredibly supportive of you with your hormone problems, or you just have a really good rapport with that doctor, then obviously it's a case of speaking to somebody that you feel can support you, but also has the specialist skills and knowledge that understand about menopause and HRT, that they can prescribe or advise you on the right things for your menopause. A lot of women that I speak to feel that their doctors don't understand about the menopause, that they don't understand about HRT, and that many women are just told, oh, well, here's a leaflet on HRT, have a look, have a bit of a read, have a look up, and tell me in a few weeks' time, come back and tell me what type of HRT you'd like. That's not acceptable. It really is for the prescriber to take charge of this and actually prescribe the right HRT depending on your own particular health needs. To actually look up about HRT yourself is, it's very complex, and that's not something that the general public should be doing. We all need to take a keen interest and have an understanding about medications that we're taking, but not to tell the doctor what to take, which does happen more often than you probably think. Male and female GPs, mixed bag. It's a difficult one. Again, I think it's just on that particular person and how you feel yourself. Some women will only see a female GP when it comes to any kind of women's health problem. Other people don't mind who they see as long as they're supportive, they understand. And some people say, well, my female GP, she's the same age as me, she should be menopausal as well, but she doesn't seem to really empathise with anything that I'm saying. But other people say, well, younger male GPs have actually been incredibly supportive. So does it matter? It really just depends on you and the rapport that you've got with that particular GP. But past experience of going to see your GP can make a huge difference, because if we've already formulated our opinion on a particular doctor, and we're already going there thinking they're not going to support me, they didn't listen to me when I went last time, they didn't support me with other problems or other family members, they haven't got a great reputation, then it's unlikely to go the right way for you. So just it's important just to remember that and take that all on board when we're seeing somebody within the practice. Thank you. So the other thing is obviously if your GP can't support you, they can refer you to NHS menopause services, and there are loads available all around the UK. Unfortunately, the waiting times are pretty steep, but there are NHS menopausal services out there your doctor can refer you to. If you decided to want to go private, lots of decisions you need to think about this, really. You have to think that from a moral and ethical perspective, how does that sit with you? How do you feel about paying for a service that you should be able to get free of charge within the NHS? And this is just something that you need to consider and think, is this something that you'd like to do? And again, it's that thinking, well, I pay my way, why should I have to pay privately to see somebody? Obviously, I run private services. I've never provided NHS services for menopause, so I only do private work. So I've got like the other side of it to give, so I can explain the benefits and the disadvantages of private services. And I think the main benefit of seeing somebody privately is the time, because if you've got 7 minutes with your GP, you will have an hour with me. Other menopause specialists, it might be less than that, it might be more. But all you can say really is when you see somebody on a private basis, you will have more time than if you went to see your own GP about this. And again, it's a case that most women feel that they're not listened to, they're feeling hurried, they're not able to get the things out that they really, really need to say. But by seeing somebody privately, it's giving somebody that time in which they can explain how they're feeling and feel that they're actually being listened to. And for lots and lots of people, they feel that that's really important to them. So that's probably one of the main benefits of seeing somebody privately. And also, instead of having to wait a long, long time to see somebody, if your GP was going to refer you to NHS services or gynae, then obviously the wait could be quite long. Whereas if you see somebody privately, you obviously, most times, the wait isn't as long, but obviously that can vary. The disadvantages are the costs of seeing somebody privately. Again, it's sort of like, discriminating people that can't afford those services. And then somebody thinking, well, how long, what's the ongoing treatments, all the services, the costs going to be. And again, before you book with somebody, always find out what the score is. How's this all going to work? Does it mean I can only get my prescriptions from you that are going to cost me hundreds and hundreds of pounds each month? Or actually, isn't it as much as you think it's going to be? So it's a case of when you do find out what different private services, do you work and find out what their services are and how is it all going to work? They should be quite open and quite honest with the costs involved and how they're going to support you long term. Some companies will, and it's just finding out what's right for you. And again, and how much investigations cost. Some private practices will charge you hundreds of pounds for maybe blood tests that aren't necessary. And so it's a case of finding out what's going on and what the score is with each one of them before you actually decide to go with them. And again, it's about assessing their credibility, their qualifications, and where to find out. I think people find me from word of mouth and because of the work that I do. So I think word of mouth is actually something that's really important. If somebody recommends somebody to you, then you need to ask, well, why? What was so good about that particular business that made you want to go with them? And always ask about qualifications. What are their medical qualifications? Are they a doctor? Are they advanced nurses? And then what menopause certificates, what menopause qualifications do they have? Are they doctors that are prescribing, or are they non-medical prescribers like what nurses are? But you need to find out their medical qualifications and their menopause qualifications, just to give them some credibility, and so that you actually are aware that these people are highly qualified, they're highly competent, they can talk the talk and they can walk the walk. And then it's, there's that big question which a lot of people say to me, if I came to see you or somebody else, would my GP, not be happy with that? Would they not agree to me coming to see you? And again, it's about speaking to each individual private company about this, because what I always explain is that it's, from my perspective, it's not working against the GP. I'm working very much with the GP in order to improve your care. So it's a lot of collaboration. It's me, the patient, and the GP giving you the best treatment. But not every private company will be like that. So find out what their rules are. Most GPs will be absolutely fine with what private companies are prescribing if they're available via the NHS. But it is important to find out. But again, if we're giving you the best treatment for you, then the GP is going to have a bit of a tough time explaining why they're not going to adhere to it, on what grounds, I think will be the statement there. So, but it's definitely worth doing your homework and finding out about the reputation of that company and how their whole service is going to work. Thank you. So the barriers to getting support. I think probably one of the main ones that people find is that there's just that lack of awareness about menopause, because if you don't know you're menopausal, then you're not going to seek help because you don't know what the problem is. So that's where training like this comes in, because I'm sure there's lots of people that are sitting there at the beginning of it thought, well, menopause isn't really going to be bothering me for quite some time. But the more they learn about it and the more that we talk about it, suddenly you're thinking, crikey, that's me, or I've got that, or I've got this. Is this me? Oh, it could well be. And it's then worth it, sort of like, lighting up that light in your head, that thinking, I've got more awareness now, so I do need to seek help. But there are lots of people out there that don't have that awareness, because they will put it down to lots of other things. And it could just be lots of other things. But as we've said in the past, menopause affects every woman. So any woman in her 40s onwards, we need to be thinking about menopause. But the ethnic minorities, some ethnic minority groups won't be open, won't want to talk about women's health at all, and menopause is not something that's discussed, and that's not discussed openly. And so a lot of women that may be in different ethnic minorities won't be open and talk about this, and find it very uncomfortable to talk to you about their health needs and about the symptoms that they're experiencing, because it's just not expected of them. And I think the thing we've got to be aware of with certain groups of people, whoever you are, is the fact that we have to be aware that not everybody is open and wants to talk about it. But it's just knowing that certain people can listen, but they might not want to talk about their problems. But then there are other groups of people, people that have got poor sight, they can't hear properly, they've got learning disabilities, women that have got autistic traits, language barriers, mental health, LGBTQ plus groups, will all experience menopausal symptoms, but might not be able to explain and get the message across in an articulate way, because of the fact that they don't understand enough. They can't, and they don't understand the reasons that they're feeling the way that they are. And so from our perspective, from a health professionals' perspective, we have to look at people that we're living with, we're working with, that may be struggling, because they are in these groups of people. And it's a case of actually thinking, well, how can we support them? Because they may feel that there's a lot more stigma associated with it. There might not be as much information in particular languages to support women with menopause. And so again, we have to be aware that the lack of information, the lack of knowledge, lack of understanding, the shame associated with it, of talking about these things, will be really prevalent and can really impact on people. But just wanted to say that I actually last night gave a talk to some mental health professionals who specialise in ADHD, because I've noticed that lots of women were coming to see me with exacerbating symptoms of their ADHD. And the menopause suddenly came across, their forgetfulness was worse, their ability to organise themselves, anxiety was increasing, agitation was increasing, irritability was increasing compared to what it had been before. So which was a clear indication that something wasn't right. And menopause, again, menopausal age, so ADHD, so autism, said all these groups of people, not to forget them, and how menopause is going to impact on these people. And it's our rights, particularly the health professionals amongst us, that we do realise that these groups may need extra support to remove these stigmas and the shame associated with it, because they might not quite grasp what we're getting at and how menopause is impacting on their lives. Thank you. So social media. Well, the good thing about social media is that it's easy accessible, and you can speak, and you can speak to millions of people and reach millions of people by different posts and threads and things like this. But it is really difficult to know who to trust and who's reliable, what information is out there. There are some real charlatans out there that are putting information up that about menopause and about health that really don't have any medical qualifications. So again, all this goes back down to finding out who you can trust and reliable information. And so it's just about warning that, you know, some people are putting information out there. There was one Facebook group talking about menopause where a lady had absolutely no medical background whatsoever, that was telling people how to take their HRT, and telling people to chop and change their medication, cut patches up, add this, add that. And, you know, it was quite frightening what I was reading, and people were listening, responding to this. And this is where it all becomes quite muddy, because, you know, it's a case that we have to assess how reliable and trustworthy these sites are. There are some amazing sites. I think it's just a case of doing your homework and trying to work out what is reputable or not. But people do find that even just talking, or reading other people's posts, again, you can relate to it. You're thinking, that's me, that's how I feel right at this moment in time. So if nothing else, you're actually feeling that you've got that bonding, because you've got shared opinions and shared views of how you're all experiencing menopause. Thank you. I think the most important thing really is the fact that we need to be talking to family and friends about how we're feeling. And they're people that we're living with, that we're potentially working with, the people that care enough about us the most, that will be seeing us probably falling apart, or certainly withdrawing and not being the person that we once were. And unless we start to talk to our, you know, particularly people that we're living with, partners, etc., if we're not talking to them, we're just pulling away because we're confused, we don't know how we're feeling. It can be really difficult for them because we don't actually know how we feel. We can't vocalize it. We don't know what it is. We just know we don't feel right. And so we tend to pull away and, you know, argumentative, moody, but we're not the person that we were before. And so partners will be really worried and think, you know, are there serious problems within the relationship? Are you about to leave? Are you about to give up your job? You know, or, you know, is your mental health being really affected with this? And they're really worried that there's something far more significant going on, because they can see that you're not the person that you were. So talking is so important. Even if you don't understand how you're feeling, just get those words out and start to talk to them and explain how you're feeling, because you'll probably find immense relief from most partners, that they will be thinking the worst and they won't be thinking that it's the menopause. They'll be thinking it's something more significant. So it's giving them the reassurance and talking things through. But that's what best friends are there for as well. Friends are there to support each other. Your best friends know you inside out and love you, you know, warts and all, and they're the people that pick you up when you're down and you pick them up when they're down. And that's what it's all about. So it's about supporting each other. And it's the fact that when you do talk to like-minded people, we get that lovely love bonding hormone, our own personal oxytocin levels, which I've talked about before. Our cortisol levels, our stress hormones are reduced, and our oxytocin, the love bonding hormones, are increased, because we're bonding and we're talking with people that mean so much to us. They make us laugh and they make us cry, and that's why talking is so important. We're venting our views and we're listening and we're taking things on board, but it's really important to talk and to listen to our friends as well, who may be experiencing the same symptoms as us. Thank you. So it's about getting support in the workplace. So if we're struggling with menopausal symptoms, it's a case of how we're going to work, how's this all going to happen at work. And so training in the workplace on menopause support, which is exactly what I've been doing here and what the wellbeing teams have organised for you. So at least you're having some training on menopause, some support and understanding of proper menopause programs that has been driven and promoted by the staff, saying that we need some support, we need some information about menopause, and it's being delivered. So, you know, it's a case that when you feel that your thoughts are being listened to, it's demonstrating that your employers are committed to you, and they're committed to supporting you and listening to you. And that makes a huge difference to your mental well-being and that feeling of being appreciated, understood, and acknowledged, which goes an awful long way for keeping you happy and productive in the workplace. And so, it's a case of other organisations need to be supporting women within the workplace by doing some basic training on menopause to start with. But again, looking at policies, I'm sure that the companies and the people that are here, if they haven't got menopause policies, they've got draft policies in place. But it is important that you do have policies on menopause within the workplace, because if there are problems, if you are struggling with work, it's the policies that are going to guide you, but also guide your employer with what's expected of you, and like a course of action to be taken if things need to be stepped up and other measures need to be implemented. And it's looking at the intranet for support as well. And I mean, these are the things that we've been talking about over the months here, is about workplace support is really, really important. And what health and wellbeing information is on the intranet, and what support groups are in the intranet. These wellbeing events are being organised, menopause cafes, and hopefully in the near future, menopause champions will be implemented as well. Thank you. So supporting those who need more help. So again, this is about awareness of the people that do have some disabilities. They are going to need more of our time, and more of our understanding, and more awareness of their needs. And I think if we think of people, I think with autism, I think it's something like 1 in 100 people have autism, but how many of these people have actually been diagnosed? So lots and lots of adults out there that do struggle understanding, do struggle with emotions, do struggle communicating properly. They may be more withdrawn from other people within the workplace or other family members. And it might just be that they actually got some underlying mental health or neurological developmental delays that have never ever been picked up, such as the ADHD that has only just been picked up during people in their 40s. So there are lots of things, and I think if we just feel that people aren't responding to us, they don't want to talk about this, it's a case of not pushing it too much, but just having that availability of an open door. And when you'd like to talk about it, I'm going to be here, but give these people extra time, extra understanding, and extra support, particularly those people we do know have disabilities. And it's making sure that we're not leaving them out and we're not forgetting them. And to talk to them in an area that they're going to feel more comfortable to discuss their symptoms with. Some people won't be happy to disclose their health history in a busy environment. They definitely want to talk somewhere quiet, whereas other people will be quite happy to chat about how they're feeling in a whole group of people. So it's really finding out what suits individuals. And again, it's about addressing language barriers or any cultural differences that are there. And it's about trying to find some literature, or at least putting some information online and translating it into that person's language, and finding out how they can get support because of their language or their cultural differences, and what is available for them. And it's about finding out how you can support each other. It may be that somebody that's got some learning disabilities within the workplace, they just need that extra bit of support, so people can buddy up, having a bit of a mentor, somebody that can talk and chat and feel that they're not actually giving them a proper menopause advice, but they're just speaking to them in a way that making them feel comfortable and at ease. And at that point, then people might open up a little bit more about how they are struggling with their menopausal symptoms, or how they've managed to cope and learn to cope with their menopausal symptoms. So it's about learning from each other, but by being there and being non-judgmental. And of course, it's about signposting people to the right people that can support everybody with their menopausal symptoms. Thank you. So to recap then, it's about, if we know that we've got some menopausal symptoms and we need to get some help, where do we go? like I said, the first port of call should be your GP, or NHS menopausal services, or health professionals that have got training in menopause, whether that's private or NHS. And knowing the barriers to getting support and helping those who need more help as well. Because if people have got language barriers, if people have got hearing impairments, then they might not be able to make that phone call, but it's just working around people's needs and supporting them within the workplace so they can get the support that they need to help with their menopausal symptoms, that they're not struggling and they are getting the same help and support as everybody else within the workplace would get. And again, about getting menopause support privately, that's all about personal choice, and obviously it all boils down to money as well, whether you'd like to do that or not. And it's looking at the things that you can look at on social media, because some social media is fantastic and others not so good. And it's about finding out who's trustworthy or not, which, like I said, can be quite difficult. Family and friends can be very supportive, and colleagues as well. Middle-aged women, we're all going to be going through the menopause, so let's try and support each other, and try and put some differences aside, and a bit of camaraderie and support for each other, because the more we support each other, the more benefit we're going to get from knowing that we're helping and supporting our colleagues and our friends as well. And one good turn deserves another. Some people need extra support at different times of our lives, but in a few months later that might be us, and we might really benefit from knowing that we've helped people and people are there to help us as well. Thank you. So we continue to have our twice monthly presentations on the different subjects related to menopause, because we want people to talk. We want people to talk and to support each other. And by generating this more open discussions and support, we're trying to remove the stigmas associated and remove some of the barriers that we have when it comes to menopause. So after this now, we're going to go through to a question and answer sessions. And then we'll go through to the Menopause Cafe, in which we're going to have some informal discussions, and we've got a couple of key questions that we're going to talk about. Any issues you have within the workplace related to menopause, then you do need to speak to your managers, Occi Health, HR, and the wellbeing teams, to really find out how you can get support within the workplace. Next month's presentation, it's going to be interesting, it's about menopause in the workplace. So obviously that's going to be very, very relevant to all of us. The websites at the bottom there are my website, which is borntocare.co.uk. I've got lots of information and support about what I do and about menopause and how I can support women. The womenshealthconcern.org is a very good website to check out for really good evidence-based information, and so is the British Menopause Society, which is the one below that. And then we've got the NHS link there to the menopause pages. And I can't read the last one, Tammy, the psychological.
That's it. Yeah. So that's the psychological wellbeing hub there, Diane, and I believe Reese just popped that link straight into the chat box. So this is available to everyone who's on today's call. If anyone needs any level of emotional or mental wellbeing support, then you are all able to do a self-referral. Literally just click on the link, and there's a short form to fill out. And everyone can have access to some sort of support that they need. So no one should be facing any sort of dilemmas or emotional support without some help there. So there we go. So thank you very much for that today, Diane.